Hello, Synapse community. We are excited to bring you another educational video today, all about stretching. And this is in line with our education series that we've been doing about the exercise guidelines released by the ACSM and Parkinson's Foundation. You should see this infographic right now. This is what we brought up many weeks ago at this point. If you do not have your own copy of this infographic today, I'm going to put a new link in the show notes for you to download this. They did actually update the link. If you try one of our older links to this, you might not be able to get to it. So please click the link in today's show notes to access your own infographic for that. Other than that, enjoy this video. Again, all about stretching, often underlooked, but a very, very important topic when it comes to your exercise program. This video is about 14 minutes long and once again has good information all the way to the end. Enjoy. Hello and welcome to our discussion on stretching today, where we will be reviewing the how, what, and why of a good stretching program for people with Parkinson's disease. And this is one of our four-part series where we are breaking down all four components of a comprehensive Parkinson's exercise program. So we wanted this to be the next topic that we bring up. We already did aerobic training, and this felt like a good next step for us because a lot of people have been having questions that stretching can help them with. So I've had a lot of people bring up topics of having muscle pain, joint pain, wanting to prevent injury while they're exercising, or maybe they are trying to work through an injury that they have. And stretching is a great topic to do and something that I would say most people overlook in their exercise program. So let's get right on into it with discussing why. Why should we be stretching? There's some good reasons, maybe not quite as profound as the reasons why we want to do aerobic training, but they are still fantastic nonetheless. So the main one is because stretching can help us to counteract the muscle rigidity that is associated with Parkinson's and help your muscles and joints to stay flexible. All right, so again, Parkinson's, one of the four hallmark symptoms that people have is rigidity. That's that neurologic kind of tightness of the muscles. Some people have it on one side of the body more than the other, might affect different areas of the body more. But this is a huge issue for people with Parkinson's, and stretching can help to counteract that. We know that people in general that are more flexible have an easier time with everyday movements. And that makes sense, right? If you're more flexible, you have an easier time getting into positions and therefore an easier time moving. Stretching can help to improve posture changes that are associated with Parkinson's as well. If you have watched some of our other videos where we've talked about how and why we treat posture changes in our exercise classes, you may recall that over time, Parkinson's tends to make the body more flexed and kind of turn inward. Gravity kind of takes over and pulls people down. So stretching out those muscles can really help improve posture. And as I mentioned before, there's a huge role in preventing injury when it comes to movement and especially engaging in exercise and that higher intensity exercise that we promote. So we want to make sure that we are stretching to prevent injury. And one of my most favorite reasons is it feels good. I hope that you have had this experience with stretching. But it can feel just really nice for the body to go through these moments, take the time to take care of yourself and your muscles. And it's usually a bit more relaxing than some of the other forms of exercise that we engage in. All right, so what is stretching? All right, most people have a concept of what stretching is, but just the very basics, it is a form of physical exercise. And it's when we take a muscle or a muscle group and we intentionally flex or extend or rotate them to the end range of motion or to your comfort level. Okay. And there are different types of stretching, and we are going to be reviewing the two main types of stretching that are promoted for people with Parkinson's. So there is static stretching, also called sustained stretching. And as the name implies, this is when you engage in a slow and constant motion that is held at the final position. or to the point of slight discomfort. Okay. Again, you should be pushing yourself to that point where it feels a little uncomfortable. But a static stretch is one that is sustained, and we're going to hold that position once we get to the end range. And we're going to hold it for about 15 to 60 seconds while engaging in some deep breathing as we do that. And most of the literature shows that in older adults, especially, that longer duration can be more or most helpful for making positive changes in the muscles. Um, with those, so you hold for the 15 to 60 seconds, and then you want to perform each of those stretches 2 to 4 times. Now, in most of our exercise classes or the videos that we record and put out in the newsletter and on YouTube, a lot of times we just do 2 repetitions just for the sake of time and getting through things. But we know that up to 4 repetitions can be very helpful as well. Static stretching is best done when performed first thing in the morning, after exercise, and before bed. You can choose what feels best for you. I highly encourage people to do this first thing in the morning. I constantly hear from people how stiff their muscles are first thing in the morning. And having a little stretching routine that you take your body through can really help you to move and feel just a little bit better in the mornings. After exercise, also very important in helping that body kind of cool down after the activity that you have done. Dynamic stretching. So what's this in comparison? Kind of makes sense. We have our static stretching where we hold those positions. Dynamic, as the name also implies, is more movement based. And this is something that we are going to perform just prior to intense aerobic exercise or strength training. Okay, so whereas static, we want to do at the end of exercise, dynamic stretching we do before we work out. We're going to go through those active movements in and out of the full range. And this is also often specific to the type of activity that you are about to do. Okay. So if you are going to be, doing a bunch of leg exercises, you want to make sure that you are stretching out your legs beforehand in this more dynamic manner. And what is recommended is doing about 8 to 10 movements in each direction. So again, if you are a member of our exercise classes, we take people through those dynamic stretches before they engage in their workout for the day. So what muscles should we be stretching? Great question. In general, a Parkinson's stretching routine should include all of the main muscle groups of the body. Okay. But more specifically, the muscles that tend to be tightest in Parkinson's are those that bend and rotate the joints. Okay, so at a minimum, a flexibility program should focus on stretching your chest, shoulders, and elbows. Again, we've talked about how Parkinson's tends to kind of round the shoulders and flex through the chest and upper back. And so we want to be stretching all of that out so you can have that better posture, better breathing. A lot of people have difficulty extending all the way through their arm and their hands. So stretching those shoulders and elbows is really important. Also the back of the thighs and the lower leg. So the back part of the leg from top to bottom, really good to be stretching out. People get so tight in this and it really limits people from being able to bend forward. And people get a lot of cramps in their hamstrings and calf muscles. So stretching can really help to manage that. Also the front of those hips, the hip flexors tend to be pulling people forward at the hips with those posture changes that happen in Parkinson's. So we want to make sure we are stretching those out as well. And as I kind of mentioned just a moment ago, the wrists and palms, people tend to have over time hands that kind of come into this more flexed position. So we want to be doing what we can to stretch out the palms, stretch out the wrists, so that people have an easier time with their dexterity and hand skills. We also want to be stretching the back and neck, which especially start having a hard time with rotation and make it difficult for you to walk with that normal arm swing and do things like look over your shoulder when you're driving and things like that. So how often? The minimum from the ACSM and Parkinson's Foundation guidelines that we've been talking about, they say in that little infographic that you want to be doing at least 2 to 3 days a week, targeting all of those major muscle groups that we just talked about. Okay. But it says in that, and I also highly recommend that daily is the most effective. Okay. And even if you do daily, you probably won't have to stretch as long as if you just do 2 or 3 days a week. You might need to engage in a longer stretching program. But if you do it daily and you're always working on it a little bit, you don't have to do as long of a stretching routine. Again, I recommend first thing in the morning as a great time to do it, but find a time of day that works best for you. Intention matters, folks. Okay, so I have watched a lot of people stretch throughout my time as a physical therapist and in exercise classes. And there's many people who just kind of go through the motions. They see what they're supposed to do, they kind of get into the position. But when I ask them, they're not really feeling anything. So don't just go through the motions. Hold good form, get guidance if you need to. If you're in a class, ask your instructor. Ask your physical therapist to help you. If you're working with a personal trainer, okay, get guidance to help you with that good form. You should be feeling a stretch. If you're not feeling a stretch, you are probably not going far enough. You should be stretching to the point of slight discomfort. Okay, it shouldn't be painful, but there should be some discomfort, a little bit of discomfort involved in it. While you are doing that stretching, remember to breathe. Do not hold your breath. And doing some nice, good deep breaths can help you to relax the body as you're stretching and go a little bit further. Precautions. Be cautious of your balance, especially if you're standing and stretching or bending forward in ways that you might not always move. Be careful of your balance. Make sure you have a support. Do what feels best for you. As we were just mentioning, do not push to the point of pain, numbness, or tingling. Okay. And caution going to the end motion if you have conditions like osteoporosis or you have an active injury. Talk with your healthcare provider, your medical team, or your physical therapist. And also a note, if you have dystonia, which many people with Parkinson's do, this may require special consideration and medical treatment for how to effectively stretch those affected muscles. And again, if you're not familiar with dystonia, that is a condition of painful and prolonged muscle contractions that result in abnormal movements or postures, okay? Again, many people with Parkinson's have this. So where to start? Well, get one-on-one help developing your stretching program, especially if you have some of those conditions that I just mentioned. So work with a physical therapist if you have injuries, pain, osteoporosis, or Parkinson's symptoms that are limiting your movement. Work with somebody that can help you figure out how to most effectively and safely stretch your muscles. And you can also reach out to our organization to help develop a stretching program that is appropriate for you by setting up an assessment with myself. We can help you with that as well. If you are just needing some more motivation and guidance, maybe you don't have those conditions, you're feeling pretty comfortable about engaging in stretching, then joining a group class like yoga can be a great way to get in some more stretching. And just a really fully comprehensive full body stretching program. I am a big fan of yoga classes. There are multiple different types of classes out there. Seated yoga classes included. So if mobility is a big issue for you, find a class where you can do stretches in a seated position. And you can also watch our stretching videos on YouTube. As I mentioned earlier, we have started recording some guided stretching routines for you to follow at different ability levels, from the chair, on the floor, standing up. So go to our YouTube channel to watch those as well. So in today's presentation, these are the resources that we covered. Please check them out for more great information. We got a lot from the Parkinson's Foundation today, also some info from the Michael J. Fox Foundation, ACSM, the American College of Sports Medicine. And yeah, and that's it. Okay, so I hope you found this useful today. And if you have any further questions, feel free to reach out to us. You can always email me at kelly@synapsefitness.org. Thank you.
This video is brought to you by Synapse Fitness Foundation, a nonprofit empowering people with Parkinson's to live their best lives through exercise, education, and connection to others. The presenter of today's video is Dr. Kelly Becker, physical therapist and founder of Synapse Fitness Foundation. If you found today's video useful, please click the like button and forward this video onto somebody that you think would find this useful. Thank you.